Could you give us some pros and cons on lip fillers versus surgery, for
Sure,
instance?
sure. So lip fillers, the main ones that we're using are hyaluronic acid fillers. So it's a sugar-based gel, let's say that's kind of made from bacterial fermentation. And it seems to be the most benign in general of all the types of fillers. So we have Radius, which is hydroxyapatite crystals or bony crystals, should never be placed in the lip. There's Sculptura, which causes fibrosis or granulation, should never be placed in the lip. And then you have things like silicone and silicone-like polymers, which should never be placed in the lip. And then you have fat. And fat itself, although people would think it's natural, it's not really a natural thing to take fat from your abdomen and put it in your face. So it does carry its own set of risks. When we look at all these options, the most predictable of an unpredictable procedure, which is injecting, seems to be the hyaluronic acid fillers because they're reversible. It
And
doesn't
they're
mean that
off
they
and
don't
they're
have.
off the shelf. They're easily accessible.
Exactly, and
Yeah.
there's an extremely low reaction rate to them, and they're in general very benign. The fillers, we've been using them for either accenting the lip, volumizing the lip, or changing the appearance of wrinkles in the lip. So we can add volume into wrinkles up here, or we can just revolumize the lip itself or improve accent. It doesn't do much in terms of lifting the lip or anything like that, like people would think, but it does help with eversion and overall prominence. The problem that we see with the hyaluronic acid fillers is, well, no injectable is predictable, meaning you inject it in one spot, it can move to another. They're hydrophilic, so they do draw water in around them and they can move by capillary action. So they can actually crawl into different spaces around them. The most, I'd say, notorious for this is Juvederm. That's the most popular that doctors use also. So it's probably the worst hyaluronic acid filler for the lip because it's the least predictable. It tends to move about a centimeter north, whereas if you use another product like Volbella, Volure, or Restylane, the most they move is maybe like 1 or 2 millimeters. So these products can migrate, they can bring in volume around them, and they can chronically over time thicken the upper lip and diminish the function of the upper lip. Diminishing the tone of the muscle in the lip can actually elongate it. So patients who use this over time repeatedly and it's crawling into the wrong spaces, their lip gets longer and expansive over time.